Kubor ka Batesi TV. Lawan ra siya da ka Orange Nissan Lumso po near Fire Brigade Shillong. Ringkat bat ka net foodish. Ordar mapi. Nginwan ra mangi hakerdog ying jongpi.
The number of cases, and that's as of yesterday. So total cases yesterday we had was 12,129, and active cases till date is 1,801, of whom 41% were fully vaccinated out of these total cases. So if we see the positivity rate till yesterday, it was about 13%. If we say 13% means of every 8 persons tested, one turned out to be positive. The new cases as of today are 116 new cases. Returnees, we have 12% out of these new cases, and active cases till today are 1,907. The deaths today we have is 7 deaths, and the total deaths till today are 170. So as if we see, East Khasi Hills constitutes more than 60% of the total cases of Meghalaya, and average cases, as I said, is 180 per day. And last year, it took us about 90 days to get this number of 180 cases, which we are getting in one day. So we can know the severity of the disease and how fast this disease is transmitting now from person to person. Average symptomatic cases we get every day is about 54 cases. That is about 30% of the total cases. And average serious cases per day is about 5 cases. So it means that 54 persons would require hospitalization every day, and 5 cases would be in the ICUs on a daily basis. The total deaths which we have is 654, of which, this I'm talking about yesterday's numbers, of which 366 were occupied and 298 are still available as of yesterday evening. In short, I would just like to say on the public health point of view that we are at war right now. We should think that we are at war, and we are at war with an unseen enemy whom we can't see, and the enemy which transmits to us through our friends and spreads to others also through us. So when we are at war, only thing we can do is either fight or flight, right? But we can't flight, we have to fight. And we also need to know what are the strengths and the weaknesses of the enemy. We know what are the strengths of the enemy, transmits from person to person through respiratory route, and we also know what are the weaknesses. The weaknesses are that we need to contain it. If we can contain it for 10 to 14 days, the enemy dies. So as ma'am has said, the only way is containment and vaccination. Protect ourselves, boost our immunity through vaccination, and contain the enemy so that it can't spread and destroy more of our community.
Kumba yang laong mentan kejengyak sisa ta district sungi kalong ke bangi day banya simkhia bangi day ne perthat ba bangi ne dang kata kejengkit khia iwe pe iwe bangin ya snok tinang banya simni kita gilat jengyaga ke bangi la hikai hi roshikata ban kita gilai te li the blue ya the kaktin thareng wearing of mask, washing your hands, watching your distance. Never more on thong iki mask. Lagi don tengte wat hayen iki wat kai di biru wat harai ilaban pimlen beling thong ka mask. Baar ini mene ye sakti ne penong ka sanitizer ka balai ko mat bangin le ka Banginya Pranzanga iwe dewe Bakni leka kabala Banginum let Sikijaka babun brew Knang banginum Don kata ka breach protocol kaba Imla an pinye jangai Tihala kata ka long rempat Ngakwa arman syom Banakini ki balyao Mentah kesini Kilau Ngut kumalahum Dr. Robert But kita kide Kiba Iwe diba sapo prasnem Iba na po nong besap Iba yak mentah kesini Nangta idi shenram Nangta ngidan pada iba handru posnem Iba na po chutwa ko Western Hills Ba i shenram itaro Nangta ngayo idan si iwe iba handru posnem ro iba di shenram Iba na motan moklam Nangta si iwe iba sampo sansnem Na po lar maureng I shenram But kikin teipat niyo iwe iba na po umpling iba la praposansnem But iwe iba praposnem iba na po maureng no. So these deaths that had happened today is more or less the age group of 48 above, up to the age of 80. And yes, analyzing the data, we have seen that the deaths have affected the elderly people, people with comorbid conditions, who do not come out of the house, that means they are non-mobile. And that is where the question of how they contract the infection. This is where there is an appeal from our district, from the health department, to kindly see that those who are mobile, the other members of the family, they do adhere to these protocols of wearing their mask properly, washing their hands frequently, and watching the distance and avoiding, unnecessary movement unless when there is a need. So, and regarding the current trend of this disease also affecting the lower age group and taking away their lives. So there is therefore a need to also strengthen the vaccination program, because on top of the 3 protocols that we have to strictly abide by, vaccination is another preventive measure that will reduce the fertility rates as well as the hospitalization rates. Like Dr. Robert had shared, though 41% of those vaccinated did contract the infection, but it is really, good news, so to say, that they did not end up in the hospital, nor did they die. That is one thing. And then, Nikwa Arupan Nakaleng Zongi, then you can do. Yakini Kilong Yang, Nabuni, Makini Yap Kilabande, Kidiba, Laramba, Kidiba, Donhay, Kibon Jeng, and then Nikwa Baki, Bahim Hasem, Kidia, Salam, Kidi, Bantikir Bha, Ban Shimi, the Kilat Sayada, Kumina Hikai. But Kumjoro, Ban Wanchakman, Ban Shimi nega vaccine, or Habaki Shimi nega vaccine, Hamakida Yadi, Padiki Bahim Hasem, but come tumbly, you could be like them, but don't be changed from Kibashohi.
Ni lại ở sâu mình phân như cái gì mà là bên khi mà khen là hết và ni lại ở sâu lùi cái chính giáo anh đi học của Khasi và là vật sẽ Spah nhiều câu Ngut và cái bà số si bên ta kalau bagi chính giáo cầm đây show Tang hasilon là saru sikui pat kijaka jong ka bakham kendong dan ini nong kendong jong ka di East Khasi Hills district habai kan ya kata pat ya yo snow kita ki COVID appropriate behavior kita ki lightly ki W mo bai madam ila on henry dan terus habai pada kaba ya ya apa la shisnam bakata pada ya ka vaccination ngaku abang ong hani bakatan ka target ka bani la shu shin kelung ba ni kimi lenti bala kumno henry pun reu hajar lai Spah prap armut ki reu Kiba hadan hapok asal shilong ni shilong agglomeration kidai kiba la saufusan senam kanta but kiba day ben yo ya ke injection habai kan ya kan ya pat hadu menden kasui kidan lai pupra hajar nyau Spah nyau Ngut kiba la kenjo saufusan senam sheneng kiba la yo ya first dose but yidang don shisha ka jingduna namal bang idan kam ban yo 6% Himla ban ong di kwa tang 0% dari 0%. But when you can lang pada but the frontline workers, but the healthcare workers, kibalak pinjo ya ka 100% senam sheneng, ya ka shinong agglomeration, nilai kot kumbah 100% kita rashim ya kaniga injection. Nakaliang jong ka district administration, nakaliang jong ka DMHO office about the health department. Nila late ba nila kentu, ba nila kendu shibun ki dorbash nong, ki dong penyat, ki dorbash nong, ki reuniam, ki prepare nila late. But nila kentu, ba nila terpat, ba kiru kenyat kentu ki beriu ban wan syakmat ban ai kan vaccination. Habai keren ya kan ni kai pi le si pi lak tip ni ba hagi kendiat sni ya khat lu ya di nong thok kubur baro but la categorize sikil kum ki frontline workers ba gila ai ki injection ko di IPR fa ban ong ba la ai san ko kan Ngut rồi ngắm tất cả ta chúng phi cái đấy cả nông ngật để ni khát số bahaya piru nama phi kita từng home nak benta cái jing bahaya jing miat trong pai da ngam ong na benta cái health department ngam ong na benta cái district administration han rei cái jing bahaya jing miat cái jing pai cái jing pia cái trong pai lam baro hoi cái bala ong ni madam le say pam dei 100% protection re hakum cái đấy kapor nyem la ban kuai kata 100% lada 70% protection ru yin yo protection bandam poi ICU hari ni menden ka si Dr. Devan jo Robert Hospital ong ke the goal ki jo ni ha bagi ai ka vaccination. The goal is whether if it is reaching the ICU, the goal is 100%. But if it is for milder disease, then 70%. The goal jadi kalau 100% ha bagi nam poi ICU la dani yo ya ka jimpang COVID. Habai kan ban biang ya ke bagi madam di ong ba lagi bidang khatra Spah iway ki active case nagita ki active case 3% jadi ada ai ki injection but 100 pulai wut nagita ki ada yo ya vaksin dose henry in OAP ba baru kita kilong stable kita gamban syam ko ICU kita gam ventilator di khot biang ba ni terpat biang ikipat ka baru subhawat afatin haba ai injection kenya menta bangin ya krem kita ki bam so don shong dori em haba ya krem balong negative ya vaksin ni long shlur haba ni tray ka kam kade bini tuk bin la ada ai vaksin ngan kapan ban yang ki ba doktor men de buang ba haba ki sumar ni ki ba pai po ICU ka khamat jong nong pang ka sentul jong nong pang kani hajan bo doktor ngau haban tap iki tube ka ba long shlur doktor kadang donation yang vaksin dengan hot so bahaya baru bagi beladap sampusan nem sheneng banya wan bat bamdei ban syatieng ya kan di ai dengan di ban shim ya kan vaccination
right now is for proper home care and home management of asymptomatic patients. A large number of persons who do contract COVID-19 do not need hospitalization. Bon ki bayo kem ya uni uknyang jingpak kim long ki ber serious hadu kata-kata let's say ki don tidak kishin dan ki symptoms ki belong mild ki berkendiat kinsat ka jing shitmat kendiat kinsat ka jing jerho kendiat ki kumno ban monitor ilade kumno ban pektu ilade ban tip lara kini kita kishin ki long ki bedon kamno ban report hospital ki dawai ki bedai bandi ki ki bapila pan de khnang bante ya ka immunity ba ya ka med ka phat ka jongpi but ki la immunity ki bapidon support nong jongpi ban yo ya ka jingarap ling ba ki healthcare workers dia kata ki khot dia ka home management minta ka health department kadang ya ki minta kadang ya persang ban set up ya kini ki home based management teams kabana ka NHM minta ngidang khot ya ki nurses ya ki kena ki belapas ya ka BDS dan ya ka nursing ban wan shakhmat ban longkum kita ki community volunteers ki community nurses for home based isolation and home care ya kini ngidang le namar kalong ka pongsan bat ka badan kam hadu kata-kata ban pekhu ban buat din ya ka jinglong jingman jong kitu ki ba shop hop hayeng bat ki ba mdadon ya ki symptoms ki ba hadu kata-kata balai ngong ya kani kalong nakada bangyo ba ki hospital kumapla semua mentan bun ki ladap ti om barok ki kesu ki badan kam bandai hospital namar ki hospital ki dei ban keta lani ban ai shwai ka jing sumar ki tu ki ba la kham jur la kham serious tila dei ba phio I corona phi dei brio I ko I bakhia don ki symptoms phi kwa ban tip unde kumno la hi ban sumar hayin la hi ban ai ka chingyarap hayin tikani ka concept ka bangin sa ai ka training yakini ki community based volunteers but ye kisnong ki thau ling ba ki kot ling ba ki training ki bangin sa ai dengan syukur pat na kaliang jong I doctor DMHO jong I ban subatai khindia halor kani kumno pin kop body la di kumno pin ai kata kajing thu haladi how will you equip yourself with better knowledge and information to be able to tackle or to be able to take care of yourself or your loved ones at home in case you do contract the disease.
There was a lot of panic among the people. Kila ting ki paiba tang suya positive kamu ki have pet naing nani ki have wat jaka bani dri. Ti hakipor wala deb ka sarkar kala ai ti jaka isolation ni quarantine. Handai munda perkhat muntaban kidang kawan pendunai kita berkhan because ni have up nisi kan don ka wave ka bahamjur banwan te hak to por kumba ngi madam dara ki upload ki jintia po hospital tani ki quarantine ni isolation jaka tingin ya bu hai kini tingin ko ban slur ki paiba by ki case ki balong mild kumba ngi madam basulong mild fever mild cough kila ban sumahi la de hayin tamak hapsa ka isolation ni te kadang kaniga pamphlet bare if I tested positive what should I do so first thing is don't panic isolate yourself at home reach out to your local health authorities monitor your symptoms when they call you let them know what symptoms you're having and then always use the mask hand washing and your distancing if possible isolation will be best in a room which is separate with a separate toilet so that your mixing up with other members of the family is very much reduced. Okay. Most cases can be easily be managed at home, mild cases. So reach out to your local doctor or to your local COVID management unit and determine the severity of the symptoms. They will through the questions and answers, they will be able to determine what severity of your symptoms. So individuals with no symptoms or very mild symptoms like low-grade fever, SpO2, oxygen concentration in the body, which is more than 95%, and no breathing difficulty can isolate safely at home. So look for a well-ventilated space to quarantine and to ensure maximum distance between you and other members of the household, choose a separate room with an unattached toilet which you can use for yourself. Then you can call the 14410 helpline, which is a dedicated line to call up the health workers to tell about your symptoms. Or any time that you feel like talking to anyone for any help, any doubt, please call this number. Then from the health authorities also nearby, they will call you back. And one more thing, after you call this number, a mobile team will be activated. After having known your symptoms from the doctor in charge of the area, they have formed a kit, it's called a small medicine kit, which home isolation kit is called. They'll come and give to you this kit at home and also teach you how to take care of yourself and how to take the medicines. This kit contains the pulse oximeter to measure your oxygen concentration in the body, a thermometer, some few tablets of paracetamol, ivermectin, and some vitamins. So make sure to report any symptoms that may be warning signs. Maybe you started changing, your health status is changing, it's getting a bit bad. So what are those things? As soon as you get difficulty in breathing, dip in the oxygen concentration, which is now getting lesser than 94%, persistent pain or pressure in the chest, confusion or inability to arouse yourself, and persistent fever, immediately you should let know the healthcare workers so that you'll be taken to a higher center for management. They say like this, that monitor your oxygen levels using the oximeter provided to you at least 3 times in a day. Morning, afternoon, evening. If you have fever, take paracetamol after food and also take ivermectin tablet for 2 days after food. Begin your vitamin C with 500 milligram tablet after food for 10 days. Drink plenty of warm fluids and eat nutritious food and rest. Above all, be in touch with your local authorities. So, This is what we are planning to do. Be supportive, careful, alert, and be kind.
There could be more of active cases who are asymptomatic in the rural areas. I think Ma'am DC will talk about the cases, the spread in the rural areas, right? So we can't take things lightly as of now. It has already spread to rural areas, and we all need to take all the precautionary measures which are required of us. On an average, we have about 1,200 tests done on a daily basis. And as I said earlier, we get about 180 cases per day. So 1,200 tests and 180 cases per day. And of these, symptomatic cases per day are about 54 cases, and serious cases are about 5 cases per day. The contact tracing. See, what we do is that whenever we get a positive case, okay, we have a team in the respective localities or the respective area from where the positive case comes, who would be calling up on these positive cases and find out in the past 10 days whom all they have met. So we do the risk profiling and find out whether the contact was a high-risk contact or a low-risk contact. If the person had not followed any of the precautions and the person was in close contact, that means the person was within 2 meters, right, of the positive case, then we take that person as high risk. Or if they have been together in the same room with no proper ventilation for more than 15 minutes, even then we consider those people who would have been in the same room to be high risk contacts. So what we do is we arrange for their testing, and then we have the transport cell which brings all these contacts to either Polo or civil to get them tested. So that is how we do the contact tracing. And as Sir has said, we also do a follow-up on a daily basis of all these people who are either positive or who are high risk. Call them on a daily basis and then find out their condition. And we have also shared the 14410 helpline number. So that number can be utilized by anyone who is under home isolation. If you have any disease, condition, you feel unwell, call up the 14410 and then they will link you to all the respective specialists who are in the different hospitals in Shillong.
Actually to stop or contain the spread. And as you've seen from the data that we've collected, the number of cases tested positive or even the number of deaths happening, it has clearly shown that there is a community spread. Okay, if there's a community spread, containment measure is to just further contain the spread. Okay, enable maybe the contact tracing, the testing, okay, and also to be able to identify the positive cases early, so that again we get to prevent the deaths happening. So that is the main thing, I mean, about containment. And regarding the rise in cases in spite of the containment, and you showed the numbers also are increasing, is because it is already there. So the containment just helps to contain or to prevent further spread of the disease. In fact, yeah, we are analyzing the reasons for the vaccine hesitancy, and we've come across also that even though people are educated, the messages, I think, which have been spread in the media, especially through WhatsApp, through Instagram, they've been more effective than the positive messages that we're trying to, also give from our department, from the district administration. And maybe the reason is that they lack the clarity of how this, the vaccination will protect them. So that is why we are working hard on creating awareness at every level, at every platform that we get the opportunity to. Because even among our healthcare workers, we have to work hard to make them understand how the vaccine works. That is one. Number two is that maybe the fear of adverse events, which is always happening with immunization. That also is being taken care of through these awareness programs. And like I said, we try even to share the data, like we have just shared with you all about, I think I just shared about markets regarding the adverse events which are happening following immunization. Do we have vaccinated, as Dr. Khongla had shared earlier, the data till yesterday was 104,692 people who had been vaccinated. But the number of AEFIs or adverse events happening are only almost till yesterday, and out of which most of them, around 98%, are very minor events, meaning it's only fever, mild fever, which is taken care of with paracetamol, body ache, weakness, giddiness, and these subsides in a day or two. And then we also give them the contact number to call us in case it persists. But so far, during the follow-up, we found out that they subside in a day or two. So this is what we're trying to share always at every platform in order to remove or allay that fear of adverse events. But I feel that the media really plays an important role in order to address also the vaccine. So I think I would take this opportunity through you that please kindly spread the positive messages or the importance or the benefits of vaccination.
Provide strategies to improve communication, especially when it comes to these measures that we are taking, right? And one of them was a cohesive sort of approach when it comes to our social media outreach. And please remember that social media only reaches those people who have access to a mobile phone or who speak English, right? So we really need to get this message out there, and many efforts have been made. But by Andrew's question, we have our NHM Facebook page, Instagram and Twitter, DIPR, COVID Task Force for Meghalaya, as well as the Facebook page of the district administration. We have seen that when people talk about their experience, that they did not have much pain, or they did not have or encounter any side effect after taking the vaccination, their friends, their family, their close ones also feel more enlightened and also feel braver to come forward and take the shot. So this is a small step which I feel we each can do. There are 20 of us in this room. If each of us share one message forward, one good text, it may have a positive impact. It can save a life. So this is not only to you, but also to the people who are out there. I'm so grateful that in the past couple of days, when we've gone to the Rangba Ashnong, the welfare societies, even the religious heads, they have engaged with us, with the COVID task force. They have engaged with the medical experts. They have clarified their doubts. And please remember that it's never too late to educate yourself. I had my doubts initially. Everyone would have had their doubts initially. But it's never too late to educate ourselves, and it's never too late to take this step to protect yourself and to protect your society. You have gotten a glimpse of the situation in East Khasi Hills, in which the numbers are on the rise and the spread is everywhere. We have a locality-wise breakup, a zone-wise breakup. As you know, in the Shillong urban agglomeration area, we have divided it into 7 zones, and we have our CNRT blocks. And we have seen that there is almost no locality or no area which has been spared. In Dr. Roberts' presentation, he has shown that now, if we look at a single day data, yesterday's, returnees constitute only 11% of the cases which are positive. 48% are contacts, 24% are people who suffer from ILI, SARI, other types of symptoms and come to the hospital, and 6% are those who have no travel or contact history whatsoever. So 78% of our cases are not returnees. Our focus all this time, our focus during the first wave was returnees. Track them, isolate them. Now there is already significant community spread. Just to give you a snapshot, these are yesterday's figures in Lagankra, which falls under Zone 1. Localities under Lagankra area, 157 cases. Localities under Laban area, 152. Under Sadar PS station, the localities there, 158. Under Lomdengri PS, 106. Under Maupat and surrounding areas, 190. Madanrating, 134. Maulai, 146. When we go to the CNRD blocks, Maurinkaneng 28 cases, Karashnang Latkro 16, Mauplang 28, Shela 22, Mausanram 9, Pin Ursula 17. And when we look at the number of cases in the rural areas as well, we see that there is an increase as the days go by, even with these containment measures. The question which was raised earlier, why have cases increased even if you have contained, even if you have put down these restrictions? Please remember, the cases which are detected today are those which were possibly spread 5 days, 6 days, 7 days ago. A death which occurred today is the consequence of someone not wearing a mask 10 days ago, right? The steps we take today will only bear fruit, or we will only see results a week later, 10 days later. So this is the nature of the disease which we are grappling with, which we are battling with right now. You have heard that in rural areas as well, there are significant numbers of cases. I'll just read out some figures for you. Sora 16, Maudiang 14, Smith 13, Mauplang 10, Shakitai Nong Kendong Ru, Kaladon Kajing Sapriang, Jong Niu Nyang Jingpang, Haki CNRD block Jongi, Kiba Keleng Saudong, Ilayo I, Babaro, Kiladon case, Badla Don Ru, Ki containment zone, Habon, Ki Jaka, Kum Hajongsha, Hapo Ishamati, Bat Hasoyong, Bat Shaway Shaway. Tang Mentagasni, Hai Artu Sao Kentang, Yo Artali Ki case, Kibayap, Nasoyong. Tekane kapin iya ni bakila don bun ki case Shakitai Nong Kendong, Kabala Bandai, Nakadao, Jong Kajing Rung, Kajing Mi, Kajing Wan, Jong Kibriu Shasor, Kajing Letra, Jong Ki, Udiu Knyang Jipang, Shakitai Nong Kendong, Tingi Don Kam Ban Sungtu, Bakajing Mut, Jong Kane, Kajing Perking, Ka Lockdown, Kade Ban Pinduna, Ban Pinsange, Shisindon, Shwa Bakan Poi, Kata ka situation kabangi ong, kabang nyedum la ban control show. Ti hakabiaday bat kani ki points kandiat nakaliang jonga, Kilong ba Sungha ban kenmau ba Ni baro ni day ban Don kacing kli halade Bat na kabenta ki bahayeng bahasem jongi Benta Iway positive case Ipin sa kriang siya Arpo samnut Lada don kano ka case Hakaway ka long yeng Ni yo i Bak kumno ru Shispa na ka shispa Ki kilalong positive Kidon ki yeng ki bangila hapan contain baro siyeng namar baro kila kala positive. Kitu ki jingyap ki ba doctor ila pule. Ki peni bakini ki bria ki ba new post nem, trapo south nem ki bam jumi shano haton no ki yo ya kacimpang. Kamut pala don ki ba yeng ba sem jo ki kon ki kseu ki parlok para jor. Ki ba trei ba yakta ba ya chani shatai bat ki ba le sikim da deng mas kim da put pikir dia kini kindon ki wan ra yu knyang jingpang ki shitam ki brio ki bala tlot lupa ka bormet ti ka jingkerpat na kaliang jonga ka dei ba nila ong ba containment ka ba mut ban pinsuki ban pinsange shisendon ya ka jing sapriang jong ni ujingpang ka jing tlot jong ni ujingpang kalong baladang nga deng mas pi deng mas pi yang ndu put Piang shimitan na jangay jonga unum yo lat ban kinti unum yo lat ban infect ya pi ladangi la ban bot tek ya kini kendon hapo hat sau sni in one incubation period ngin la ban te la kam shi sendon ka point ka ba ka bagila ya kren sapang u vaccine ngathai ngamdon kam shu ban bun ktien halwa kata hendengi kentu ya kibrel ban wan shakmat kenbao batang hadin Kendai 4% jong population jong ini yo ya utika nginum la ban long protected 70 to 90% of us need to be vaccinated so that we can achieve herd immunity. The other option is that every one of us gets infected, but if that is the case, then many of us may also lose our lives. So please let us take that sense of responsibility to fight the virus. Kapag ako aban ongru, ngin yale i uni uknyang jingpang, daka jing start, daka jing tip. We will fight this virus with knowledge and with science, not with hearsay, not with rumors, not with false beliefs, and not with sentiments. Ni don kam ban snap iki doktor. Langi kthakli gilet ki doktor. Langi bayong kli gilet ki doktor, langi pang ni om ni sitom gilet ki doktor, ni snap ni buat tek pum babatay maki. Minta ki ong wan syakmat ban shim ya kani kacing ya da balai ni rantin. Tingi kentu ni kerta girayo ya kacing kersan kapahdu kata-kata nakaliang jong kisnong kinong yalam niam henry dang don hi section hi bang pat wan syakmat ka health department ka district administration ka covid task force on the district task force on covid-19 ka ploy ban wan syakmat ban pensya ya kinu kicing artatin ban ay ya kicing hikai halor kani so ba bandeng ya lagi mas nila ay ko order ba kajing deng mas hatemu kajing deng mas klem datap ya khmut kajing deng mas khli kanum dan jing mentoy iru wear your mask and wear it properly ngimla bantip kanlong kumno la shai la shisngi henrei la dangi bot hek bat ni sumar sukhe de kini kendon ngatharai ngimla ban yada yi ki bathon ki jongi. The last point I want to address is regarding the containment, because there has been a question on it. We are trying our best, and in the past 5 days since the containment measures have been put in place, we have seen that there is public support. People have respected the lockdown. People have understood what is the purpose of the lockdown. Let me tell you that the lockdown is not to, like I've said before, inconvenience anyone, but crisis times calls for critical and urgent measures. We have to act now whilst we still have time. The state government and the health department is doing everything in its capacity now to augment our health resources. By tomorrow, the Corona Care Center at IIM Nongthmai will be set up, will be functional. We have placed orders for more oxygen, for concentrators, and we believe that we can do this. We will not be able to go for lockdown forever. We will not be able to shut down our economy forever. Kanumla lang. Nginumla panle satya ya kata bangin kangdam si sendon hindray kumba kalong minta kadang peloy than ban ya kanu karai. Ngidang hap ban buat pikir ya kini ki baro but hadien ba le se ngin hap play suki ngin hap aila di kibriu ban kamay im jakpo ngiru ngidon kam ban let chaki kam ki jam ki jongi ngim dei ban shim sting shu ngadang yo ban let rung sakat tu kat ni ki government office ki private office ki tangis hak ba ki brio ki dang yo bun ktien klem da deng mas ken mau ba pin yo kem yo khniang jing pang na ki brio ki ba phi itho hi iba Robert ila ong Dr. Robert ila ong ba our positivity rate was 16%. Iway na prangut 1 out of 8 persons tested is positive. In this room, we are 20 of us. So 3.5, 2.5, at least 3 people here, if we test, we are very likely to be positive. So it means what we have stressed on during the first wave, everyone should consider themselves to be an asymptomatic carrier. Berkat bat kenya ladi bapila manlong unong ra ubla don kabriu ni ubriu o pila bandon bupai tau khnyang jingpang hendai kimpa kidakishin kumno phinga banyada ya di bade kiwai deng ki mas thet ila ki jong kti penjngai iwai na iwai pat and do not drop your guard.